When I first became an athletic therapist over 20 years ago, I used muscle stem units to help decrease pain. It may have been used for acute lower back pain, pain as a result of a motor vehicle accident, or even pain post surgically. Now, athletes are using these units to help decrease pain from delayed onset muscle soreness, but they're also using it to help improve their recovery from that workout. Now, what athletes need to realize is that there is more than one type of unit. There's microcurrent, there's IFC, there's TENS, and there's low frequency electrical stimulation. When we look at the research, the problem is that we're using different parameters in different papers. So we see differences in wavelengths, differences in frequencies, and differences in treatment times. So we can't compare one paper to the other equally. It's not comparing apples to apples. When we do look at the research and we kind of bring it all together as best as we can, when we look at microcurrent, we find that it has no effect on pain and has no effect on strength or power, but there might be an effect on creatine kinase. Creatine kinase is an indirect measure of the amount of tissue damage. So if we see less of it compared to a control group, there is an effect on the healing process of recovering from the workout. When we look at IFC, we find that the results kind of vary when it comes to muscle soreness. But when we look at strength, power, range of motion, and the levels of creatine kinase, we see no effect at all. When we look at TENS, the TENS does help decrease pain and soreness, but it has no effect on power or strength. And lastly, using the low-frequency electrical stimulation, we see a reduction in blood lactate and creatine kinase, but no effect on pain, no effect on strength, power, or range of motion. So when you are considering using an electrical stim unit, you've got to decide what's your goal. Do you want to decrease pain, or is your goal to aid in reducing creatine kinase, hopefully speeding up some of the recovery? Based on that, you can choose which type you want to get.